What happens when you get sick in Kenya? One American retiree's education in Kenyan healthcare, the confusion, the competence, and the hard-won peace of mind. By Hakeem D. Freeman, Nairobi, Kenya. Nobody tells you when you decide to retire to another country that the first real test of your decision will not be the language or the loneliness or the traffic. It will be the morning you wake up with something wrong, a tightness in your chest, a fever that won't break, and realize you have absolutely no idea where to go. That morning came for me about 4 months after I arrived in Nairobi. I was 62, 3 years out from a career teaching high school math in the Bronx, and I'd told everyone back home that retiring to Kenya was the smartest decision I'd ever made. It still is. But the pain in my side that morning, a kidney stone as it turned out, my second, stripped away every bit of confidence I'd built up. I did not know which hospital, I did not know which number to call. I did not know whether my insurance card, issued by a company headquartered 2 states from where I was born, was worth anything on this continent. I sat on the edge of my bed and felt profoundly, completely alone. That experience, miserable as it was, turned out to be one of the most useful things that happened to me in my first year here, because navigating the Kenyan healthcare system is learnable, but you have to be willing to learn it on its own terms, and the preparation has to happen before you need it, not during. The single most important thing any American retiree must understand before relocating is this: Medicare does not cover you outside the United States, not for emergencies, not for anything. This is not a loophole or an edge case. It is total, categorical, and non-negotiable. The day you board that flight, your American government health coverage ceases to function. What you need, purchased before you arrive, is an international health insurance plan with explicit coverage in Kenya. Ideally one that includes direct billing arrangements with Nairobi's top private hospitals. Paying out of pocket and seeking reimbursement is possible, but it is slow, exhausting, and often involves submitting paperwork in triplicate across time zones while you are already unwell. Find a broker who specializes in East Africa expatriates. Read the policy carefully enough to know exactly how to trigger an emergency evacuation if one is ever needed. Then carry a printed summary of your coverage, along with the insurer's 24-hour emergency line number, in your wallet at all times. The hospital admissions desk will ask for both. Once the insurance question is settled, the rest becomes navigable, and the first navigation should happen before you are sick. Register with a general practitioner at a private hospital in your first weeks. Become a known patient with a file and a relationship before you need an urgent appointment. In the same spirit, get a full baseline blood panel done early. Lipids, blood sugar, thyroid, kidney function. It becomes your local reference point for everything that follows, and it signals to any subsequent doctor that you are the kind of patient who takes their own health seriously. The first thing I had to unlearn was the American assumption that more expensive means better, and its corollary, that a system unfamiliar to me must be inferior. Kenya has its own hierarchies, but they don't map onto American ones. The public sector serves the vast majority of Kenyans and operates under significant resource constraints. But the private sector in Nairobi is genuinely world-class in ways that surprised me. The Aga Khan University Hospital and Nairobi Hospital are the 2 institutions most often recommended to expatriates, and both are accredited to international standards. My cardiologist at Aga Khan trained at institutions I recognized. The radiology equipment was newer than what I'd encountered at my VA facility back home. The consultations, this surprised me most, were longer and more attentive than almost any I'd had in the American system, where 15 minutes with a doctor has come to feel like a luxury. Ask your GP for specialist referrals early and proactively. The referral network matters here, and navigating it cold is slower than going in with a name. The consultations surprised me most, longer and more attentive than almost any I'd had in the American system, where 15 minutes with a doctor feels like a luxury. There's a wrinkle to my experience here that I didn't anticipate and that I think is worth naming honestly. In a country where the overwhelming majority of people share my complexion, I am not read on sight as a foreigner the way some of my expat friends are. Security guards have addressed me as Mzee, a term of respect for an elder man, before I've said a word. A nurse once asked with genuine surprise why my Swahili wasn't better, assuming I'd grown up here. I've had to get comfortable correcting that assumption gently and often, and I've thought a great deal about what it means to feel both unusually at home and still underneath it, like a man whose American passport and American assumptions about medicine set him apart. It hasn't disadvantaged my care in any way I can point to. If anything, the warmth has been disarming in a good way. But it's a layer of this experience that has nothing to do with hospitals and everything to do with what it means to be seen, and I'd be leaving something out if I didn't mention it. But I also had to adjust to a system where the patient is expected to be more active in their own record keeping. In the U.S., my medical history lived in a network of interconnected databases through the VA and my old employer's insurer. Here I keep a folder, an actual physical folder, with my test results, prescription history, specialist letters, and vaccination records. I bring it to every appointment. My doctor, a quietly efficient woman named Dr. Waweru, told me in our first meeting that this habit would save me more than any medication. She was right. The Kenyan system will not hold your hand the way the American one does. Even when the American one is at its most maddening, it asks more of you. The return on that effort, I've found, is a kind of ownership over your own health that the industrialized American model had quietly taken from me over the decades. And if I'm honest, a level of attentiveness I'd stopped expecting from a doctor's office a long time before I ever left the Bronx. Appointments in Kenya are, to put this charitably, suggestions. I have arrived on time for a 10 a.m. consultation and been seen at noon. I have also arrived at 10 and been seen at 9:45 because a previous patient canceled. The scheduled slot exists here more as an aspiration than a contract. I have learned to bring a book. I have learned that the waiting is not disrespect. It is a different relationship with time, one that extends the same flexibility to me when I am the one running late. The pharmacy system deserves its own consideration because it upended almost everything I thought I knew. Many medications that require a prescription in the United States are available over the counter in Kenya. This can feel liberating until it feels alarming. I have had to develop discipline about not self-prescribing simply because I can, and to be thoughtful about sourcing. Chain pharmacies like Goodlife and Halton's maintain proper cold chains and dispensing standards. Smaller outlets are more variable. For my chronic medications, I manage hypertension, which has been a fact of life since my 40s. I now source a 3-month supply through my doctor to avoid inconsistency. M-Pesa, Kenya's mobile money system, is accepted at almost every pharmacy and clinic. Setting it up early makes small payments frictionless in ways that cash rarely manages. What I did not expect was how excellent the treatment for tropical illnesses would be. Malaria diagnostics and treatment in Nairobi's private hospitals are faster and more confident than anything I could have received in the U.S., where a physician might see a handful of cases in a career. The first time I was tested for malaria, a precaution after a trip to the coast, the result was back in 20 minutes, and the protocol, when it turned out to be negative, was explained with a calm authority that reassured me more than any amount of anxious late-night searching had managed to do. It is worth knowing before you travel domestically which areas carry higher malaria risk and to discuss prophylaxis with your GP in advance. Your Nairobi doctor will know This is their landscape. In a way, it simply is not your American physicians. 2.5 years in, I have a cardiologist, a GP, an ophthalmologist, and a dentist, all within 15 minutes of my home in Kileleshwa, all of whom know my name and my file. I know where the nearest 24-hour pharmacy is. I know which emergency room to go to, and I have driven past it enough times to know the route by instinct. My prescriptions are managed. My annual screenings are scheduled. I have read my evacuation coverage carefully enough to know exactly how to trigger it and have quietly hoped I never need to. What I would tell any American retiree considering this move is that the system here asks you to be your own administrator in ways that the American model, for all its frustrations, largely handles for you. That adjustment is real, but the cost of care, even in the private sector, is a fraction of what I paid in premiums and out-of-pocket maximums back home. The quality at the institutions that serve the expatriate community is not a compromise, and there is something in being known by your doctor, genuinely known, not as a patient number in a portal, but as a person whose history she has read and whose face she recognizes, that I had stopped expecting from medicine a long time ago. You will get sick here as you would anywhere. The question is whether you've done the work to be ready when you do. That answer, I have learned, is entirely within your control. Depending on the morning, that is either the most frightening or the most liberating thing about it.